type in, I'll give you about 10 seconds, a brief description of what you would tell somebody else what sports pharmacy is. Go ahead and press enter. Okay, incredible. So we've got some definitions piling in. And this is why I like this, because you kind of just get a flood of different responses.
This is really a great day because we reached our 4th annual International Sports Pharmacy Symposium. Then Athena Cannon from USA. She's a PharmD also, ambulatory care sports pharmacist, founder of US Sports Pharmacy Group. And she is also a speaker and consultant. She will also present us and publishing a definition of sports pharmacy. We are also several times trying to come together as online meetings, and we as some little groups, we are trying to make a proper definition for sports pharmacy. But today we will have chance to discuss all together after many years. We want to also make a proper definition.
Thank you, everybody. Good morning to those in the United States, and just welcome for those around the world. My name is Athena Cannon. I'm the founding chair of the US Sports Pharmacy Group, and I feel really honored today to be amongst all the incredible and impressive speakers and attendees. I've been a part of ISPS from the beginning, and to see it grow and to see the amount of collaboration and the amount of participation in events like this from around the world is really, really exciting. So as Samer mentioned, today we're going to be focusing on Defined Sports Pharmacy Task Force. There's a lot here, but luckily Abdulmanem did a really great job at outlining the history, which I'll be referring to. So a little bit about the US Sports Pharmacy Group. We're an organization in the United States, first kind of non-officially created in 2020, when we got a group of about 12 pharmacy students, researchers, and pharmacists together that had a shared passion of sports pharmacy and an interest in learning more. And many of you guys here today were attendees of that very first meeting in 2020. And we're really proud to show that in 2022, we were able to move up and become an official nonprofit in the United States. And we've been working to serve as a network of pharmacy professionals who share expertise and experience in sports pharmacy to educate the sports medicine community of the pharmacist role in all of the things that were already talked about today. So optimizing performance, enhancing well-being, and promoting interdisciplinary team care of patient athletes at every level. And so there was already talk about recreational athletes, but we're also acknowledging that we have neighbors, family members, friends, colleagues who are also physically active, and those individuals are mentioned in our definition as well. You can see our vision here. And again, really just our goal is to help lead the advancement of pharmacy professionals among all of you who are doing it internationally. In the US, of course, we have very specific scopes of practice. We have different areas of pharmacy, and that differs depending on where you are, where you practice, what your practice setting is. And so part of us is, raising the bar in the United States because as you all know, who have been a part of sports pharmacy for a while, we may be a little late to the game with some aspects of pharmacists being integrated into the athlete's care. But at the same time, we're really excited to collaborate with all of our international members and organizations to help lift everybody up. So in 2024, the US Sports Pharmacy Group Board of Directors met to go through what is going to be our strategic focus for the year. So you can see, we had 6 different items that we felt were very important for our organization, especially being a new organization. But many of us have been active in sports pharmacy for a while now, at least a few years. And so today I'm going to be focusing on our strategic focus of endorsing a definition for sports pharmacy. And you'll see this timeline as we go out, just hopefully to break up the presentation a little more, to give you that sense of what the process was. And you'll see that we're really proud of the work that we put into this initiative, but it really wasn't without all of the help. And hopefully I do everybody justice by making sure to acknowledge everybody and all of you that participated in this. So I first want to start out with one of the questions that we got throughout this process as we were seeking feedback. Why create a sports pharmacy definition? So if I can, in the chat, I'm going to try to ask us to type, just very briefly, our definition of sports pharmacy. Don't press send yet. I'm going to have everybody press send together. So go ahead if you're near your keyboard. Type in, I'll give you about 10 seconds, a brief description of what you would tell somebody else what sports pharmacy is. Don't press send. It's okay if you do, but go ahead and type it in. I'll give you about 5 more seconds. Okay, so on the count of 3, for those who were able to type in the chat, we'll press send. So 3, 2, 1. Go ahead and press enter. Okay, incredible. So we've got some definitions piling in. And this is why I like this, because you kind of just get a flood of different responses, which is really fun. So I'm seeing helping athletes reach their best performance, meeting athletes' needs from the pharmacist perspective, sports supplements and medications, handling athletes' well-being, dispensing drugs, pharmacotherapy, specifically in women, pharmacists who are specialized, the subcategory of pharmacy. Okay, I love this. There was a little bit of nerves going into this question because, if we got just an overwhelming amount of comprehensive definitions, we might have to scrap this entire initiative, which would be kind of sad. But I think you guys are on the right track of everybody has their own definition based on their experiences. And what we found was that there were definitions out there from the history of pharmacists working in sports that maybe were a little bit limited or describing pharmacists' actions in isolation. So for instance, just a pharmacist's role in anti-doping, just the clinical duties when pharmacists are working with competitive athletes, but maybe not recreational athletes. And of course, some of the current definitions didn't necessarily address the diverse pharmacy practice settings or holistic care of the athlete or use of non-pharmacological interventions, which, for the clinicians here, that we're using non-pharmacological interventions to either optimize medications, prevent the progression of disease states, those types of things. So that is the basis, one of the bases for why we created the sports pharmacy definition. So in 2023, 2024, we did identify this need, just being involved in sports pharmacy. We want to make sure that we are able to unify globally, as opposed to maybe having various niches of sports pharmacy that aren't, necessarily coherent. But I did love the sub themes that Abdul-Manem or the sub areas of pharmacy that he pointed out. And hopefully those fit really nicely into the definition that we were able to create. So in August of 2024, we put a call out to create a national and international task force within the US Sports Pharmacy Group. So you can see our task force members here. Many of them have been involved in sports pharmacy for a really long time. Some of them are, maybe newer, but have really rich experiences in their areas of practice. And we really tried to get a diverse perspective when crafting this definition. So you can see there's ambulatory care, primary care, there's anti-doping, there's consulting, community, hospital, university athletics, a student perspective, coach perspective. We have 2 international task force members that we're really proud to have involved, Claire May and Sommer. And not just because they're located in another country other than the US, but because they're very heavily involved in multiple sports pharmacy groups. And so that perspective to bring in, what might this look like globally if it were used was very important to us. So in order to craft a definition, as Abdolmanem pointed out, sports pharmacy has been around for a while. Whether it was called sports pharmacy or not, it's really important to know that, this definition is not necessarily a unique idea from our task force members. We reviewed literature, 20 national and international publications or organizations describing sports pharmacy practice. We also reviewed 123 US Sports Pharmacy Group member definitions, which is part of the application process to become a member of the US Sports Pharmacy Group. And we reviewed 5 definitions from other sports medicine professionals just to get a sense of how other professionals define themselves within the area of sports. So on the screen here is a QR code. Feel free to scan it. This is a details document for the entire process of our task force. We also cite all of those publications that we reviewed to give credit to all of those pharmacists and researchers who have been doing the work for many, many years. This is also available on our website. So if you don't get to scan it, you'll be able to see it later. Okay, so once we reviewed all of the articles, our task force team identified themes and sub-themes from the member definitions, the articles, and just generally kind of how we define our role in sports pharmacy. So you can see that there were 8 different themes, and we made sure that every single draft of the definition encapsulated all of these themes. There were 3 iterative rounds of review for the draft definition so that we could get insight from the US Sports Pharmacy Group Board of Directors, multiple different disciplines, and just, making sure that everything made sense. Our goal was for the definition to be presented to not just pharmacists in the pharmacy profession, but also to other healthcare providers that you might work with that don't quite understand what the pharmacist role may be when working with athletes. So the next thing that we did was we kind of drafted a definition. Because this presentation is only 20 minutes, I'll spare you all of the drafts that we had. And if you've ever been a part of, creating policy reform, creating a definition, that there's a lot of wordsmithing that has to be done in order to get it correct, or as correct as possible. I don't know if there's a perfect definition that's able to exist, but we really hope that with the perspective that we gathered, that we're as close as possible. And so I'll show you where we landed. So after this entire process, getting all of the feedback that we did, going back, making sure that all the themes were accounted for, making sure that all the different types of athletes were accounted for, we were able to create a core definition and then a brief responsibility statement. And I know this is a little hard to read, so I'll break it down for you. And I will say too, so the core definition is really that definition that describes sports pharmacy. We decided to add a brief responsibility statement to help illustrate pharmacists practicing in these settings, and kind of a broad view of how pharmacists might practice. But you'll kind of see we intentionally left out details. So I don't want to spoil it for you, but just know that it is a broad representation of responsibility for pharmacists. Okay, so looking at the core definition, sports pharmacy is the specialized practice of pharmacy that focuses on the use and education of therapeutic interventions, including but not limited to medications and supplements to optimize athletic performance, maintain sports integrity, and support recovery for athletes and physically active individuals across all demographics. So in the details document, you'll see that there's an explanation of terms. We were very intentional to understand why we chose the terms that we did. And so we chose specialized because we want not only the pharmacy profession, but those that we're working with to understand that sports pharmacy is a specialization. At this time, as you know, especially in the US, I'll speak for our experience here, there's not a lot of programs that educate specifically on sports pharmacy broadly. They may educate on performance enhancing drugs, but a lot of those lectures may miss the connection between what the pharmacist role is. And so, you know, there's a lot of pharmacists who are interested in getting into this field. And as Abdulmanem already mentioned, there are trainings that are required because it is specialized. You don't want to give athletes or athlete support personnel wrong information when working with athletes because they are a special population outside of maybe the ordinary patients that we work with. We chose therapeutic interventions because pharmacy is growing, pharmacy technology and medical technology is growing. We received a lot of feedback during the rounds of what about pharmacogenomics? What about these other devices that we're using? And again, we wanted to be able to capture all of that. We wanted this definition to be a timeless representation of what our role as pharmacists are. And so the very specific wording of including but not limited to, because also pharmacists have varying scopes of practice no matter where you're working. And so you might be a pharmacist that also has, you know, education in physical therapy, and you might use some of those non-pharmacological interventions as long as it's within your scope. And so that was the way to capture all of those things that we might not know we'll be using in the future. Medications and supplements. I think this one's probably a little bit more self-explanatory, but I will say we didn't find that medications and supplements really fit all aspects of chemicals or products that we might use in athletes. Like here in the US, nicotine, caffeine. Caffeine could be maybe more like a food product and less like a supplement. So again, therapeutic interventions kind of capture those that don't fall under the specific definitions of medications and supplements. Sports integrity. We chose sports integrity because we want the pharmacist to be able to work with the specific sports organization and their rules. So of course, as we know, not all organizations follow the WADA code. I work with an organization that, or kind of 8 different organizations at least, that have all their own rules to some extent. You know, some are modeled after the WADA code because that is the gold standard, but then some are very different just because of the nature of the sport. And so we wanted to make it broad enough that pharmacists are helping athletes maintain sports integrity because that's really important for sport, but also for the athlete's health and trust as a healthcare provider. And then physically active individuals across all demographics. Again, this is just to capture all of those individuals we might be working with. Okay, responsibility statement. Sports pharmacists practice with the highest standards of professionalism and ethics, adhering to relevant laws, regulations, and policies set by appropriate governing bodies. Again, this was broad because other healthcare professionals may not know what our role is, but we want them to know that we practice with the highest standards of professionalism, that we are going to be aware of the laws and regulations, maybe with our board of pharmacy, but also with the anti-doping organizations we're working with, or the sports governing bodies, or, whoever kind of sets regulations and policies around our work. So that is intentionally kind of broad. And then interprofessional teams refers to the collaborative approach where professionals from various specialties work together while integrating their unique expertise to optimize athlete care. This word has been changed so many times. So I appreciate everybody's feedback. And I think we landed on the appropriate one because, as Abdulmanem already mentioned, being integrated is a really important aspect of sports pharmacy. And then medication optimization. I think, again, that one's pretty self-explanatory for our roles and our goals as pharmacists. And then I think I just got really excited and was just highlighting all sorts of sections in here. So I think you guys can read the rest. Okay, so this definition is intended to be broad and accessible. Okay, so it's crafted to clearly communicate to both pharmacists, non-pharmacists, as I mentioned, all physically active individuals, all demographics, all competition levels. This definition is not a comprehensive list of every responsibility or duty of sports pharmacists that they might have across any practice setting. And it's not intended to limit the pharmacist's core responsibilities or duties. Again, we tried to make it as broad as possible. We understand that depending on where you work, the job description, the type of athlete that you work with, you may not have, you may be doing very specific things, and we wanted the definition to be able to capture that for you while still communicating that it is a specialty, it is a role of pharmacists, and these are specific ways that pharmacists can help. And again, we hope that this definition can be used as a way to uniformly communicate and unify us as a profession. So is the definition specific to the United States, which is definitely relevant here at ISPS? And so again, the definition was created to encompass the broad scope of sports pharmacy. We have Sommer and Claire on our task force, and we use this collaborative approach to ensure that any language and terminology could be applicable and understandable worldwide. Again, we didn't necessarily look at every single country and how they define supplements, how they define medications. But again, we're hoping it was broad enough that it can be used internationally, again, as a goal to help unify us as a sports pharmacy profession. And then the next part of this, so we have the definition. Right now, we're sending the definition out. So the board of the U.S. Sports Pharmacy Group approved the definition. We're sending the definition out to members for endorsement and then also external stakeholders, because we know that having endorsement from external stakeholders and our members can help strengthen the definition and increase the impact. With that, I mentioned there were a lot of people that helped with this process, even if it was just kind of, one-off feedback. So I want to acknowledge all of those people. USSPG Board of Directors, Robin Mullen, Adrian McKenzie, Rise Llewellyn, Henry McKinner, Mark Stewart, Todd Sorensen, James Smith, Mary Klein, Norman Tamaka, Kevin Walker, and Emily Shears, and of course, all of our task force members, as this was not a single person initiative. With that, here's the sports pharmacy definition. It's taken a while to get here. We hope that this is something that you feel proud of, even though you weren't necessarily a part of the task force or maybe the acknowledgements, but you are a pharmacist helping push this initiative forward and giving meaning behind this definition. And so, as I mentioned, right now we're seeking external endorsement. Feel free to scan the QR code. And it's on the next slide here. Feel free to scan the QR code. There is a survey that can give you the opportunity, or your organization the opportunity, to endorse the definition or give feedback on the definition. And then, of course, for more information. Here's the US Sports Pharmacy Group email. You can find us online, LinkedIn, Instagram, and again, that details document is on the website. So before I open it up for questions, I do want to invite any task force members to put their name in the chat, say hi, because again, I want to do my due diligence of acknowledging the incredible amount of work that was put into this, and invite you all to reach out to any of our task force members if you have questions. And I think that's it.
Yes, Athena, thank you for your continuing and endless efforts because you are always leading all these studies. Maybe it has been 5 years, maybe more, and as a group. And finally, you are looking for the best definition, and so you have all these difficulties because when we discussed before, okay, maybe you can find a definition regional, for example, in for the US view, or we can find another definition for another in the point of another country. But also we discussed about to find the global definition. But we believe that the starting point is important. If you succeed this to find the proper and the best definition, this will be a model for the other countries because it depends on the legal regulations, legislations of in each country. We can see that there could be some other different approaches. I believe that your all these studies will help to find us the correct way. And let's check for the chat zone. I
And
think.
I do want to add
Of course, please.
in the
Of course,
chat,
please. Yes.
in the
Yes,
chat.
please.
Ashley did say, I don't know, to be honest. Ashley's she's our education committee chair. She's also a lead of ISPN. She was also my first mentor in 2018. She's absolutely been a part of this process. I have no idea how her name was not included in that. So I just want to say out loud that her name will be added, and she was a huge contributor to this as well.
All right. Thank you for this contribution. This is really important.
So for those who are interested in the future of endorsing, but maybe didn't get to scan the QR code, email info@ussportspharmacy.com. We want to make sure to capture you. But if you're a member of the US Sports Pharmacy Group, you already have some version of that link. But thank you all for your time and can't wait to see the rest of the conference.
All right. Thank you, Athena. Yes, we are definitely recommending all the participants to follow the USSPG group at LinkedIn, especially in LinkedIn. They are so active and regularly sharing important posts. Thanks again, Athena.